Welcome to this introductory lecture in HIV. My name is Dr. Manyara. By the end of this short video, you will learn the epidemiology of HIV and how it affects the cells of the immune system. In short, we will discuss the natural history of HIV. The HIV virus first came to light during the early 1980s. A number of healthy gay men in New York began to develop a rare opportunistic infection and cancers that were resistant to treatment. So, over time, it was renamed HIV as it caused a decrease in the immune system. Since then, the number of those infected has increased steadily, but of course, with ARV treatment, the lifespan of those affected is now close to the normal lifespan of those who are free from the virus. 2 years ago, in 2019, there were 38 million people living with HIV, of whom about 36 were adults and 2 million children. Let us now look at how HIV affects the immune system. When an individual gets the HIV infection, the HIV virus is transported to the host's lymph nodes. After that, the HIV uses the host cells to replicate and multiply itself so continuously, making new viruses that will continue to infect other cells. The virus targets cells which have the CD4 receptors, and these cells include the T helper cells and macrophages, and of course a few others. For the HIV to be able to get access into the host cell, it requires another receptor which is called the co-receptor, and this can either be CCR5 or CXCR4. So for the HIV to be able to get into its system. Remember, it is the HIV getting into the host cell system that is able to manufacture more viruses so that it can infect other cells. When the HIV stays outside of the cell, it is not able to replicate itself and it will die a natural death. Once the HIV attaches to the receptor and the co-receptor, the viral envelope fuses with the cell membrane of the host cell. After that, the contents of the HIV are released into the host cell. The contents include 3 enzymes which are reverse transcriptase, the integrase, and the protease enzymes. The genetic material of the virus, RNA, is quickly transcribed into a single-stranded DNA, and a copy is then made to make it double-stranded, just like the host cell DNA. This is done using the reverse transcriptase enzyme. So it needs to do this so that it looks like the host cell and so that the immune system does not recognize this. The double-stranded DNA is then quickly incorporated into the host genetic material by the integrase enzyme. This is a survival tactic because remember, the virus cannot survive outside the host cell. If it did not do this, the virus would then die and would not be able to replicate itself in order to infect other cells. Integrated viral DNA then turns the host into a factory for manufacturing more viruses. That is the only way it is able to infect so many cells. So even if a person does not get other new viral infections, the few viruses continue making new viruses and hitting other cells of the immune system, steadily decreasing in the number of CD4 cells. Initially, these viruses are produced as virions which must be cleaved by the protease enzyme in readiness to be released from the infected cell. Knowing this cycle is crucial in order to know the targets of the antiretroviral drugs. Once a cell is infected, it is destroyed by HIV, and therefore the CD4 counts continue to decrease day by day. When the levels become too low, then other opportunistic infections come to play, and it is this time then that we say a person has AIDS. This can take many years to manifest, but with antiretroviral drugs, this can be averted. During the initial infection, there is an acute HIV syndrome in 40 to 90% of patients, and they present with adenopathy, pharyngitis, headache, skin rash, and a fever, and generally malaise. This is, however, transient, and some patients may not even notice it. During this time is what we refer to as window period, and a person who is infected may not have antibodies yet. So if you went ahead to do an antibody test, it would turn negative. However, the best test at this point is the antigen test. Seroconversion occurs between 2 to 8 weeks from the date of infection, and that means the time we are really able to get the antibodies in the infected person's blood. About 90% of people will test positive within 3 months of exposure to the virus, and the rest of the 10% will test positive between 3 to 6 months of exposure. In summary, HIV is a retrovirus which enters and makes copies of itself to infect other cells and then continuously destroys the human CD4 cells. It is not capable of surviving outside the human cell. Do join us for the next series of videos in HIV, and until next time, goodbye.